Okay, as you're sitting there, just go ahead and just let your eyes close. Now with your eyes closed, I'd like you to focus on your right hand and your right arm and notice how heavy it feels. And as you're focusing on your right arm and hand and how heavy it feels, think about how light your head feels right now. It almost feels as if there's a balloon attached to the top of your head, just lifting your head right on up. And at the same time, your left arm is feeling heavy, but your left hand is feeling light. And it's getting lighter and lighter with each breath that you take. And every time you exhale, you're going to feel both of your legs getting heavier and heavier, but your right knee is getting lighter. So light, as a matter of fact, that your right foot feels almost as if it's ready to come off the floor. The left side of your head beginning to feel so heavy that your head feels as if it's going to roll to the side, while the right side of your head is feeling heavier yet, trying to keep it in balance. You feel as if you want to swallow, but you don't. You feel as if you want to keep your eyes in one position, but they want to seek another. And I want you to feel the warmth in the palms of your hands, the weight of your feet on the floor, and your right arm getting lighter and lighter as your left arm gets heavier and heavier, and your left hand gets heavier, and your eyes are so relaxed. And now all I'd like you to do is take a nice, long, slow, deep breath and let go. And let go of all the tensions of the day, of all the problems that you have felt. Just let them go, as if nothing really matters right now. As a matter of fact, nothing really, really matters except the next breath. And if the next breath is comfortable and pleasant, you will also feel that the next one can be even more pleasant and comfortable and enjoyable. And you know, Deborah, if you keep on breathing beautiful, deep breaths of fresh air that are calm and relaxed, then you will feel that you're building up a history of long, deep breathing, each breath becoming seconds and minutes, hours, days, and weeks of pleasant experiences as you let go of all the problems in your life. Now, for the sake of brevity, once again, I can talk elsewhere and you will not need to pay any attention. In the confusion technique, you get a person focusing on one part of their body, and no sooner do they get focusing on that and try to do what you ask them to do, such as feeling the weight of one arm, when they find out the weight of their other arm is the exact opposite. Or maybe their left knee is very heavy and their right knee is... I'm going to advance forward now, and I'm going to show a deep trance phenomena. Deborah, in that deep state of relaxation, I can introduce you to a technique that will help you. Suppose you need to go to a dentist. Do you know that you can use hypnosis to alleviate pain? Use what we call glove anesthesia. You could make one hand very, very numb, and then you could transfer that feeling from your hand to a part of your body that is feeling uncomfortable. I'm going to show you how to do that. Now, you may or may not be in a very deep state. I may need to spend an extra 10 minutes with you or an extra half hour with you to get you into a deep enough state for you to experience this. But I'm going to show and demonstrate exactly how this works. You get somebody, get your client into a deep state of relaxation, and then you just simply tell them that you're going to touch the back of their left hand, and you're going to put a liquid on the back of their left hand that is going to be cool And I'm going to put that on your hand now, Deborah. It's going to be cool. And it's going to get colder and colder. And as it gets colder, it's going to feel as if you just put your hand in a bucket of ice water. Your left hand from your wrist to your fingertips is getting colder and colder, while at the same time your right hand is becoming warmer and more sensitive. Sensitive to the air, sensitive to touch. But your left hand from your wrist down to your fingertips is very, very numb, and it's getting more and more numb with each breath you take and with each word that I say. As a matter of fact, if I were to touch the back of your right hand, you would notice how sensitive it is. If I touch, I'm going to take the pad off. If I touch the back of your left hand right now, you're going to notice how numb it is. In fact, you're going to feel pressure, but no discomfort of any kind whatsoever. If I do the same thing to your right hand, you're going to feel very, very sensitive. But the left hand is extremely numb. Now I'm going to show you what you can do with this, Deborah. I'm going to count to 3, and when I get to 3, I want you to take your left hand and stroke your jaw, the right side of your cheek and the left side of your cheek. Just stroke it as if you're just feeling the surface of the skin. Just do it maybe twice on each side. And you will find that when you do, and you put your hand back down in your lap, that you will transfer the numbness from your left hand to your jaw. 1, 2, 3. And as you put your hand down now, your hand is now sensitive. Your hand is now sensitive, and I'm going to show you as I touch the back of your hand, it's sensitive. But your jaw is numb. The surface of your jaw, the inside of your jaw, your teeth are all very numb. You're going to feel pressure, but you will feel no discomfort of any kind whatsoever. You can use this technique. This only took just a matter of a couple of minutes. This is just the second time that she's been hypnotized. You can take this technique, and if she is feeling any pain anywhere in her body, she can transfer that numbness from her hand to that point in her body, and maybe get down to the doctor's office. And then the minute she walks into the doctor's office, she's going to feel sensitive in that area again, so she can explain to the doctor where she's feeling uncomfortable. But let's say that she has a dental appointment next week. She can go to the dentist's office while she's sitting in the waiting room. She can be saying to herself, my left hand is getting colder and more numb, colder and more numb. And in about 15 seconds, her hand will be numb and cold. And then she can say to herself, I'm going to put my hand up to my jaw, and I'm going to transfer it on the count of 3. 1, 2, 3. And as she touches her jaw, she transfers it from her hand to her jaw, and now that she can tell the dentist, go ahead and do whatever work you want to do. This works for people who are allergic to anesthesia. This works for people who have a problem with gagging in a dentist's office or anything else whenever a dentist comes close to them with a drill or their fingers. It works extremely well with childbirth. You get a woman who is in the last 3 or 4 months of pregnancy, and all you have to do is teach her that the moment that she walks into the hospital or is wheeled into the hospital, that the moment a doctor were to touch her in the area of the birth canal, any place in that area whatsoever, that she will immediately become numb in that area. And then she will remain so until after the baby is born. You can do this in a way that whenever she's in the first stages of labor, and she's in the labor room. All she needs to do is make her left hand numb within a matter of seconds, and then place her hand on the lower part of her abdomen and around the surface of the uterus and just transfer that feeling there. Now, Deborah, I'd like you to notice how numb your jaw feels. But on the count of 3, and I snap my fingers, the sensitivity is going to return to your jaw. And if I were to touch it, you would be fully aware of my touching it. Now, 1, 2, 3. The sensitivity has returned to your jaw. I'm going to touch your jaw on the left side of your cheek right now, and I want you to notice how it feels. Take all the time that you feel is necessary for you, but I'd like you to remember from this point on, Deborah, both consciously and subconsciously, anytime you want to, you can make your left hand numb, or if you prefer, your right hand, make that hand numb and transfer it on the count of 3 to any part of your body that you want to alleviate or to eliminate pain. If it is only a pain that is day in and day out pain, you can do it and leave it. If it is pain that you need to alleviate until you get to the doctor's, you will find at the moment you get to the doctor's office that the pain will return sufficiently for you to be able to explain what the problem is. And this is to prevent you from not feeling any pain and being life-threatening. Does that make sense to you? Okay. Now what I'd like you to do is spend whatever period of time is important for you and bring yourself back to the point of where your eyes open and notice how really good you feel about these new learnings and what you can do with them. Wide awake. Your hand feel comfortable? Sensitive?
I can feel it.
Like normal?
Yeah.
Okay. Your jaw? It's okay? Okay. That's good. Any questions? You'll be able to remember that, won't you? So you know how to do it now. All you have to do is tell yourself that from your wrist to your fingertips, you're going to make it numb. And you can make it numb by saying the word water 3 times. Or maybe you can make it numb by saying in 15 seconds, I'm going to give it 15 seconds to be totally numb. Or snap your fingers with your right hand and make your left hand numb. And you can do anything you want to make it numb. But tell yourself it's going to be numb, and then you can transfer it to wherever. Let's say that your right arm in here is feeling pain. You just put this hand on top of it. You don't even have to use the back of it. The whole hand will be numb. You can put this hand on top of the pain, and then you can say 1, 2, 3, and put this hand back, and the pain will be gone because now that will be numb. Okay?
Thank you.
Feel good?